Dr. Leigh, you know, I know you're doing also orthodontic work, basically the braces. That's correct?
Yes, that's correct.
Yeah. Tell me, I mean, I know just by looking at children walking around and that this braces thing has changed dramatically. I mean, I do still remember seeing children. I never had them, and that they have like this heavy metal work in it, really ugly. And now that's becoming nicer, clearer. They even have colors on it, flags of schools and flags of countries, and all kinds of things, Valentine's hearts, and then. There seems to be also that new thing where you have braces like mouth guards kind of, which are rather invisible. So please shed some light on what's available there and how has technology improved there, because that may be quite important for people who stay away from straightening out their teeth because they surely don't want to have those ugly braces. Tell us about it.
Sure. Well, yeah. I mean, you mentioned the how you put it as a mouth guard that moves teeth. That's Invisalign, and it's a clear tray and it's very thin, and it's something the patient wears. You get a set of them, and each aligner moves the teeth, rotates the teeth in a certain manner according to the prescription, and it's comfortable. It doesn't affect the speech. Probably one of the side benefits is, especially in adults, is what we find is that they lose 8 to 10 pounds when they're doing Invisalign. So not only are you improving your smile, you're slimming your waistline at the same time, which that's kind of an unintended benefit of Invisalign.
Why was that again? I'm lost again. Why do you lose that?
I'm sorry. Because you have to wear these aligners 22 hours a day.
I heard weight loss and I went, I think I need it.
Well, because you can't eat with them in your mouth, and you have to wear these aligners 22 hours a day, and it does. I mean, you're just not going to snack like you normally snack with these aligners in your mouth. I mean, you can eat your normal 3 meals a day, and you have to make sure that you brush and keep your teeth clean because you don't want to create other problems. So again, that's why. And you have to drink water. You can't really drink coffee or anything that's going to stain your teeth. So those are probably the main things that some people have to adjust to. But again, it's temporary. They don't have the brackets and the wires in their mouth eat at the same time. So, I mean, there's going to be a payoff, as far as not having to wear the brackets and wires. But so if you want to call it a downside.
Yeah, so basically there's that. I can see that because if every time you eat, you take the braces off, so you snack a little less and you drink more little water. So basically slightly healthy lifestyle. But let's go back to the, to the teeth. So I can see, because normal braces, you don't take them off when you eat, so the food gets stuck, and dental hygiene has to be very, very heavy. Because is it true that sometimes people who are slightly slacking on dental hygiene while having braces, a year and a half, 2 years, whatever it might be, that when the braces come off, their teeth are beautifully straight, but now they have gum disease?
Right, or they have cavities. Yes, they have gum disease. Yeah, exactly, both. Gum disease, cavities. And again, that is the benefit of Invisalign, because you can take them off, eat, brush your teeth, and put them back in. And we see a lot less incidence of these gum problems or problems with cavities after. I've only seen it once in the hundreds of cases that we've treated.
Now, let me ask you, is the treatment longer or shorter with Invisalign rather than with the traditional braces?
It averages about the same. It might be a little bit shorter. It really depends on the particular case. Sure. Most cases can be treated with Invisalign today. I think when they first started, there were some limitations, but just like anything else, there's been progress in how we can treat the patients, and there's very few cases where we have to actually use traditional braces.
Wow. Okay. So that's basically pretty good. Now, let me ask you. So a person wears these braces. I know that I heard that originally they were made mainly for adults, simply because teenagers, they're a little flaky. They have lunch and they chase the girl or the boy after lunch, and they leave the aligner there. They don't put it back in, and then kind of it defeats the purpose. Is that still the case? Do you find in your practice, are you putting it on teenagers and children also, or only on adults?
Well, we do treat teenagers. Actually, I just started a case today on a teenager, and the thing is they have to have their adult teeth. They can't have any baby teeth in their mouth. And we have what's called Invisalign Teen, so we can really monitor their compliance with these special aligners that can actually tell us if they've been wearing them or not. So there's again, just like anything else, it's progressed, and they're offering it now, and they're tailoring it towards teenagers because that's where your greatest compliance issues are with anything is with teenagers who are preoccupied with everything but their teeth.
Right. So basically, again, you mentioned the weight loss because of the, having the Invisaligns. It could also be, most of us men, we're kind of like become men when we join the army, even if it's maybe only for a half a year or whatever it is in particular countries. In my country, it was 9 months. And, everybody says once you come out there, simply because of that discipline thing, that's, yes, sir, no, sir, and, and getting up at 6 and being punctual and all that stuff. And so I guess a child or teenager would probably become a little, used to become responsible by, being forced to follow a certain protocol.
Yeah, that's one way to look at it, and you just have to be careful. I mean, most of the teenagers that we see here, they're motivated to do it,
sure.
And we're not going to force anyone to do anything they don't want to do. So if they're agreeing to it, then they're going to be compliant.
Right. Okay. So let me ask you. So is an Invisalign number one? If I speak to you in 3 to 5 feet away, which is something like that, I guess 10 feet with normal speaking distance, can I see it? If you would wear Invisalign, would I see it?
No.
No,
you wouldn't be able to notice.
So they really are invisible.
I would say so, sure, absolutely.
Wonderful. And what about if a child loses one of those aligners, steps on it, cracks it? Even for an adult that can happen.
It's not a problem. They just let us know. I mean, it happens, and we just order a new aligner. It's not a problem. They're warranted, so they replace them very quickly. The turnaround time might be a day or two, maybe 2 or 3 days, actually.
So do lots of adults, kind of like who have crooked teeth. Maybe they had braces when they were young, but then they didn't maintain them afterwards too well, and somehow they got crooked again, especially like in front, a couple, 2, 3 teeth only, like just do lots of adults take advantage of it instead of grinding them down and put veneers and lumineers on it?
It depends. We could go either way, and it really depends on how quickly they want to have it done, and how concerned they are about preparing their teeth for veneers or crowns.
Right. But are there plenty of adults who are going for a straightening out of their teeth?
Absolutely, yes, and a lot of them are cases where they had orthodontics as children, and there's been some relapse, and a lot of times it's just a very simple, maybe 8 to 12 months of treatment to get the teeth back where they belong. So it's very quick, and additionally, what we look for crowding on the anterior and the lower front teeth and the upper front teeth because it can create problems with the gums and the bones. So it's not just a cosmetic benefit. It actually benefits the gums and the bone that supports the teeth because it's easier to keep them clean if they're not crowded and overlapping each other.
I see. So if you have teeth which are kind of like not fitting the way they should, then you don't have the space to floss and do whatever. Now you get gum disease, and you have talked in another video about literally how devastating gum disease is, from the liver to the kidney, the heart, the brain, the total immune system gets shut down. So I can see why. Yeah. Okay. Wow. Mm-hmm. Well, it's all kind of like, interlocked, isn't it?
Exactly. Yes. It all ties in. And even functionally, if the teeth aren't lining up together, they break, they can crack. So again, getting the teeth positioned properly in proper function, they look good, they function properly, and they don't break.
Good. Well, to wrap this up, so Invisalign is a great advancement when it comes to orthodontic work, yes or no?
Huge. It's a huge advancement, and everyone should consider doing it.
I'm sure the people who had braces like the adults now, 30, 40, whatever, and they had braces 20-some years ago, I'm sure they kind of go, wow, that's a different world, right?
Absolutely. Yes. Yep.
Good. Well, Dr. Leigh, thank you very much.